Hello, I'm Dr. Mary Wyatt, an occupational physician. Many of you will be familiar with the health benefits of good work policy developed by the Faculty of Occupational and Environmental Medicine. I'm a lead fellow on the latest and probably the most important of our series of policies on work and health. We look at the evidence on work injury scheme design and in particular the gap between current practices and evidence. So I've spent a few years looking at the evidence and how we can improve work injury scheme design. An important component of that is how policies are shaped and how they ultimately influence schemes and our workers. We know that when people have a work injury or a compensable injury, the outcomes are worse than for people who have the same injury in non-compensable circumstances. This really is crazy, particularly when you think about the extra resources that are provided for people with compensable injuries. It's poor for the worker, it's poor for their employer and the community. It costs a lot, both in terms of human cost and the economic cost. Many policymakers have been trying to improve how return to work progresses, but unfortunately, there's been no material change in return to work rates over the last 20 years. We need to do better. It's important to understand how policy impacts work schemes and impacts workers. We all have our own views about what should be done and what should be improved. But the field is complex and we need research to help us understand how we can improve. The Compare project makes a significant difference in helping us understand the impact of policies. What works, what doesn't work, how can things be improved? Alex and his team have the smarts and the statistical capabilities to look at big data sets and complex ways of understanding the outcomes of policies. I'm really looking forward to the Healthy Working Lives Research Group presenting their findings and their important work.